contribution to Healthy People 2030, I led the chapter on nutrition and healthy eating in rural America, along with 4 other co-author experts. I also collaborated on the obesity and physical activity chapter led by Dr. Jay Maddock. Both of these topic areas and in the rural context are the basis for more than 2 decades of my community engaged research and evidence-based program dissemination efforts. So it's really an honor and very exciting to collaborate with other experts on these chapters. In terms of what stood out to me, it really shouldn't surprise me because of my work with partners in rural communities throughout Texas, as well as many throughout the US. It's always sobering to see the data related to how residents of rural communities fare compared to urban counterparts. For example, nearly 90% of high food insecurity counties are rural. Rates of hypertension, obesity, diabetes, cardiovascular disease, sugar-sweetened beverage consumption, and fruit and vegetable consumption all tend to be poorer in rural communities. Poverty rates and food access, particularly financial and physical access to food, continue to be key challenges for rural residents, and that can be compounded further for older adults and families of lower socioeconomic status. In addition to distances to stores, existence of stores, and affordability, the quality of produce and other fresh foods is also a key barrier to consuming a healthy diet. In terms of what I'd like to see going forward, given the shift in focus at the community level up to the federal level on nutrition security rather than just food security, I'm really excited to see how we can move ahead to address both hunger and adequate calories, but also the quality of the diet to make sure that people can eat foods that optimize their health regardless of where they live, their income, and other related factors. I'd also love to see new innovations that advance all dimensions of access, including things such as mobile markets for fresh foods, healthy corner store programs, and produce prescription programs as highlighted in our chapter. One thing I'd like to emphasize is how important it is to include community voices from local rural communities in the solutions development process, from farmers, schools, and store owners to residents and community-based organizations. Solutions to address rural nutrition security and healthy eating will be far more effective and more sustainable when there's participation and input from a broad range of community members.